Appreciate coming here. I was thinking about it. I have been here with this group before. It was either 2018 or 2019 because I was sitting here looking at this and I was thinking about the group and thinking about the Tea Party group. And I remembered a story that I told last time I was here, was that in 2010, I was at the Boston Tea Party. I live 2 hours outside of Boston. I was there. I got a phone call from my father who said, "Are you seeing what they're doing out in Boston? This is crazy. This is amazing." I'm like, "Yep. See you, Dad. Should have picked you up. Sorry." So yeah, I'm with Americans for Prosperity, our education and training team. And I've been doing medicine for about 20 years. I started as a volunteer firefighter in my hometown, eventually became a paramedic, ran ambulances in 3 different states. And in that, I saw on a daily basis our healthcare system crushing people. And right about the same time in 2010, I watched as someone tried to put a one size fits all, let's change how everything is billed, but not make any access to healthcare better. They didn't talk about being able to have more doctors, didn't talk about being able to reach healthcare, they didn't was seeing anybody. All they talked about was who's going to pay for it. That federal response doesn't really work. So when I started with Americans for Prosperity in 2018, I got to start to travel the country and talk about this stuff, and it's been really awesome. I actually came to Virginia starting in December of 2018, was here over and over and over again. I actually, in 2020, between January and February, up until about March 4th, I spent about 4 weeks total. And then I didn't come back for about 2 years. This is my first time back in Virginia Beach, so happy to be here. I'm psyched. Something happened. But in 2019, Virginia actually did something awesome for the residents here in terms of healthcare, because the solution isn't at the federal level. It's states being able to help each other. Prior to 2019 in Virginia, it was illegal for a doctor to get paid for telemedicine services. So if you call your doctor, email your doctor, I'm not even talking about Zoom. That wasn't even a thing in 2019. You couldn't bill for it. You couldn't bill your insurance for it. Medicare, Medicaid wouldn't pay. Private insurance wouldn't pay. There were some doctors out there that were able to make it work, but there wasn't set up as a system to be able to do it. Virginia in 2019 passed unanimously to allow for telemedicine to exist in the Commonwealth. So awesome job for everybody here. I toured the state. I started on one run here in Virginia Beach talking about that, went to Richmond to talk about it, went up to Northern Virginia to talk about it, and out into the Shenandoah Valley to talk about that with the Americans for Prosperity team. And what we found is at the start of the pandemic, Virginia was set up better than almost every other state in the country for people to be able to talk to their doctors. So awesome. Yeah. Yes, round of applause. This is you folks here. I was honored to play this tiny role in it, being able to talk about telemedicine, because I've used telemedicine as a paramedic for a decade. I can walk into a hospital. I can talk with a major trauma center on my cell phone and share a video of a car accident scene. So if in the highest of highest stakes environments, I can hold a webcam in a small emergency room to a major trauma center. If I can do those in the highest of highest stakes environments, everybody should be able to do that at home if they choose to. And that was a big component. There's no mandate to force someone to do telemedicine. It's your choice if that's how you want to proceed with your healthcare. So that started out as what turned into this national campaign that we call the personal option. So we hear this public takeover of our healthcare. This is the personal option. There is no one size fits all change that we can make that will solve all the problems in healthcare. It's state, there's some federal things, but there's mainly state things that we can do to change healthcare in this country for the better. A major one that is really hurting Virginians right now are certificate of public need laws. It's the main thing I'm here to talk about. I heard a yup, all right. What always happens is that I've been talking about this again for 4 years now. I come into a room, people have either never heard anything about it, or it's, I hear so much about it, I have a tattoo on my arm that lists it down, and there is no one in between. So to the tattooed folks like myself, awesome. To those that aren't, these are laws that 35 different states in the District of Columbia have, that for a healthcare provider to open up a new service or for somebody to start a new business in healthcare, they have to go to a government board to get approval to open, to expand. So an emergency room wants to add more beds, government approval. The problem is everybody else who already does that medical service gets a say. So, and this is, I'm going to embarrass myself a little bit with this story. In 2019, I was here in the summer, and the next day I was headed up to Williamsburg for an afternoon training. And I was looking at my map and I was trying to figure out my drive over. And I was like, oh no, that's like really quick. That's super easy. There's this tunnel and it just says I can get over super quickly. This is perfect. And everybody did that. They all laughed at me. The entire state staff, Michael Wigington just was like, no, just you need like 2 hours, dude. You know? So as an example of certificate of public need laws, a request was put in to open a skilled nursing facility here, elder care. And this is within this area of Virginia Beach. It was denied on the grounds that there is a facility in Newport News. The idea being that will take care of everybody over here, right? Yeah. Right, they don't want competition. The people in Newport News absolutely had a say in saying, well, we don't want that. We can take care of them. And the state said, sure, you can take care of them. But as even I know, it is not reasonable to expect care to be able to go across that bridge every day when you need to, or go under. It's not reasonable, but that's what happens when it's a board and they're influenced by people. I put on my phone just 4 or 5 different stories from throughout the state that I've seen. Commonwealth, sorry, I'm from Massachusetts. We are Commonwealths. That's important. Chesapeake Healthcare wanted to start open heart surgery down here. I was reading a few articles on it. The current folks have a monopoly. There's only one place that you can do the open heart surgery. Very important surgery, I can say. In my time as a paramedic, I have brought patients into hospitals that they've gone straight from my ambulance into open heart surgery. You want to have as many of those as you possibly can. And quite frankly, if a hospital says, we think we can support this, I'm going to call them the experts. But no, they actually got denied to be able to open up. Wow. And it gets even worse in Virginia. It gets even worse in that eventually they got approval to open their open heart surgery center and right in Chesapeake Healthcare right over here. Mm-hmm. But the state commissioner then said no. So one person then turned it down. The monopoly got to him.
Wow. Yeah, well, Centera has a 95%, I think 95% rate of getting what they want, and they got rid of DePaul. So it took them, how many years was it? It took them about a decade, but they got rid of DePaul.
Yep.
From what I remember.
Yeah.
The timeline.
Yeah. So they got to one person who could turn it down. Now, this is really cool. I was just sent an article that the Supreme Court here overturned his decision. Mm-hmm. So as of right now, they're approved, but I'm still holding my breath on that one. So we are seeing those small victories in it. Certificate of public need laws have failed in committee for the last 2-3 sessions that we've tried. So what we're doing and what we're partially kicking off tonight is for the next several months throughout the summer and into the fall, I'm going to be crisscrossing Virginia talking about certificate of public need laws, flying in as often as I can to talk to different groups about these laws, to be able to say, this is wrong. We can't have it. There's medical technology that doesn't exist in Virginia that exists in Maryland and Delaware. If I can get personal, my brother-in-law died from colon cancer because he never wanted a colonoscopy. I get it. Without getting too detailed, we all know that's pretty invasive and not the best day in the world. There is technology to use a CT machine to scan So instead of having to go through that whole procedure, a doctor can go through first with just a CT exam. Can be able to do that. Non-invasive.
Won't cover it.
Yep, less personal.
Yeah,
This group does it. They do it in Delaware. They do it in Maryland. It's covered by the insurance. It's like insurance companies love it because it's less invasive. It's cheaper. It's quicker. There's less medication. There's less risk of error. You know, it can be a little dangerous. It's not a fun day for anybody. Insurance companies love it because it's cheap. It's in and out, and colon cancer is really expensive. That colon cancer screening is really cheap. So they like that one. They like. They're never making a profit on us if we get colon cancer, but he didn't want that embarrassment of the exam. They applied, the group that does this in Delaware and Maryland applied into Northern Virginia to be able to set up shop. They wanted to set up a freestanding clinic where they did this initial setup with their own machines, their own equipment, just as that initial setup. They were denied. I think we all saw that coming, that I was going to say that. The reason for the denial is that there are plenty of other organizations and plenty of other hospitals that can do this if they so chose. You don't own the technology. They could choose to if they wanted to. It didn't matter that no one's doing it. This was years ago. No one's doing it. No one's going to do it. No one wants to do it. They were denied because, well, if they wanted to do it down the road, they could. This is
Denies free market.
right. This is the exact crushing of the free market. In places that don't have certificate of need laws, we've been able to really isolate for that. Medicine is 5 to 10% cheaper. You are getting in that much quicker. It is weeks and weeks. We're seeing, I always use the CT example, the MRI machines, because we've all either seen them in person or they've always been on some television show. The normal wait time is up to 2 to 3 weeks in most certificate of need states. It's days in states that don't have these laws.
That to me is not just the money, it's a lot more people would go because they're not afraid of the colonoscopy.
Right, it's, yeah.
So they're costing lives.
Yeah, these laws, I apologize. This is going to come off really melodramatic, but yes, certificate of need laws are costing lives. We've seen it. There are people that never got that scan. There are people living in pain because they can't get that appointment, or it's 2 weeks away. And if you don't have insurance, they're expensive. We hear from the hospital systems that, and I get it, they said we overcharge for the CT machines. So because we lose money on the emergency rooms. Like, all right, I get 30, 40 years ago, 50 years ago, when these laws came into play in the 70s. All right, the CFO then did that, set up the budget. So yeah, you can, if you have the only machine in the county, then you can charge it. All right, fine, whatever, I get it. But it doesn't, I don't care. Sorry, people are hurting, people aren't getting care. And if you have the only machines, if you're overcharging, that means someone without health insurance can't afford to get their shoulder looked at, can't afford to get their knee looked at, and are going to walk around the rest of their lives in pain. Yes.
Well, the problem is we have a monopoly.
Mhm.
I'm not going to mention the name of the company, but they have rolling mammogram buses all
Mhm.
over. And if they had competition, it might bring the price down. It's
Yes.
funny how we've got drugstores on every corner, but we can't have CT scans within, a driving distance. You have to, get permission from the state. And those people that are lobbied by those people to make the decisions are those very monopolies who want to keep it all.
Yes, you get the monopoly, so you get the income, and then you can afford to. It's unfortunate, and no one was talking about it for about the first 25 years of certificate of need existence. They started with a federal mandate because of Medicare, Medicaid. The federal government was afraid that everybody everywhere would open up an office and then just suck them dry. And it's like, well, no, that didn't happen. So they figured we can lower prices if we can control the supply, which makes me chuckle. And this is the most hilarious thing about certificate of need laws. In 1986, the federal government repealed all certificate of need, or in Virginia, they're called certificate of public need requirements. it was very strongly put out from Congress. The president signed that these laws are bad. Every state should repeal these laws. That's the first time I've ever heard of the federal government saying a regulation is useless and should go away. And even today, every year, when they put out their reports of how to improve healthcare efficiency, even the federal government says we should be repealing certificate of need laws.
I first learned about it from the group called Americans for Prosperity. And it was before the pandemic. And really, it was an exciting thing. But it took a crisis for people to shift a paradigm.
Yep.
And I think that the person who influenced me the most is named Shah Desant, who's a doctor who does CT scans and all that. And he's really helped by going up to Richmond to push for this stuff. So if more people would lobby to remove this certificate of need, if people understand what's going on, then the better. I'm glad you're here to inform people of that.
Dr. Shaw is awesome. Virginia native, born in Virginia. His dream was to get into radiology. That's what he wants to do with life. Became a doctor to serve his community. He was born just outside of Richmond, I believe. And that's all he wanted to do, was open up an office, have a couple machines running where he could just do the day-to-day scans on his neighbors. He applied, he put in for the certificate, was immediately denied. It's been 8-9 years now that he's been trying. All he wants to do, a Virginia native, all he wants to do is serve his local community in the way that he best can serve his community, and he can't. He figures this fight costs him so far well over $100,000. And he put up an offer in 2019. It's a great video. It is still on YouTube, where he said, instead of spending that, if we had been able to repeal these laws in 2019, he would have given out enough free MRI scans at his office with that $100,000 instead.
Wow.
So that he still is keeping to that promise that if we can get these repealed, the underserved members of his community, he is willing to give those out for free, to waive the copay, because it's that important to him.
Will there be lobbies again to go up to Richmond
Yes.
in
Yep.
Winter to when they're
In
sessions?
session. Oh, yes. Yep. We'll be going up again. We'll be getting buses again. I'll be around. It was really cool. I got to come back for the first time, like I said, in a few years in January. I got to spend the day, sat down with a few delegates, sat down with a few senators, and kind of talked about it as a person. I kind of live it every day. So being able to speak on that was a ton of fun.
Should be able to have like what did Trump said about having, like when you go to McDonald's, you have a menu at a board that tells you how much things cost.
Yes.
Where you could go in and just look or call and compare compare prices, but they don't allow us to do that.
That's the heart of the personal option. In my bio, I talk about how it should only be you and your doctor in the doctor's office. Right now, there's also an insurance agent, there's a government regulator, and then probably a second government regulator, and then someone from the state. We need to cut through all that. So whatever you and your doctor feel is best for your treatment at that time, whatever you agree on is what happens, and that price transparency. The Oklahoma Surgical Center is an amazing example. They post all their prices. They don't accept any insurance, but they post all of their prices on what they do. People fly in from all over the world to get treatment there because it's honest pricing. And to kind of tie it back, the last point that I'm always thinking about on this is that we're always talking about who's going to pay for it. Honestly, it doesn't matter the piece of plastic in our wallet, that insurance company, who's paying for it, if the doctor doesn't exist. Because right now the machine doesn't exist. Right now the doctor doesn't exist. Dr. Shaw is staying and trying to fight. How many doctors left? How many nurses left Virginia to go to a different state that didn't have these laws? I actually know several. There are dozens of doctors that left Kentucky to move just over the border into Indiana that doesn't have certificate of need laws. 5 minutes over the border is where a whole bunch of native Kentuckians Are currently
From the other state and. go
moved into
there,
Virginia. No
and then
certificate
go
in
over
health.
there and get them done?
Not usually.
That's another problem.
Yep, not usually. Yeah.
So the certificate of need, does that
Mhm.
just mean that they can be in business or not? It doesn't have anything to do with inspections, that's a whole
Nope.
different.
It's just if they can build or expand.
Well, that's nice.
You know, there's 21 different things, I believe, right now. It varies state to state. The smallest, I think, is one state has 17 things covered. Most states have 20 to 30 different things. So surgical centers, MRI machines, long-term care, emergency room beds. Out of the 35 states, 13 states at the start of the pandemic removed or reduced their certificate of need laws. Virginia did not. North Carolina said you can do whatever you want, increase your bed capacity by 10% without even telling us. Anything above 10%, you go through the process. South Carolina said, just let us know what you did. Nope. April 2020, we were talking about bed capacity. That was it. It was bed capacity all day. That was all that was on the news. So about a half a dozen states just said, yep, if you need more beds, just send us a note to tell us you did it. We trust you.
That's all the red tape.
Yeah, which is great. Good for them. Now make it permanent. Yeah, so that, I mean, I wrote down like 4 or 5 other stories, but right now, if you go to personaloption.com, that's our kind of collective site that talks a lot about federal priorities and a lot about all the different state priorities. So that's personaloption.com. It's kind of the umbrella because I could talk about 14 different state level legal changes, but this one's going to impact people every day immediately. We saw it in Florida. We repealed the laws there, and a hospital outside of Jacksonville immediately said, okay, we were denied before. We are opening a 100-bed hospital just outside of Jacksonville. Clay County, so a little closer to the seacoast, Baptist Hospital, they had filed to put an extension, 100 beds, 700 employees, $100 million extension. They were denied in 2015. The
So options are in this.
singular, personal option, personaloption.com. Yeah, they were denied. The instant Florida repealed the laws, they said, they dusted off the plane and said, we're doing it. I would trust that hospital system more than a government. Like, that just proves to me that like it was that important to them that they built this. And of course, the same thing, they announced it in February of 2020, they were going to add 100 beds. Didn't help, but yeah, eventually it will. That's what we're missing.
So once that law is gone, they don't need approval at all.
Nope. So there's the normal, there's still the same building code, same building regulations, all of that. So there's the minimum standards of being able to set up. But what they don't have to do is say, I would like to add 10 beds, please. Here's my plan. I've spent $1 million on attorneys, which is a pretty normal fee. May I please expand my hospital? May I please replace my machine? So you don't have to spend that years-long process. It's just a notification to say, we are building this. We are expanding our hospital. I am going into business to open my own radiology lab. Yeah,
Okay,
that was it. Thank
all
you.
right, thank you so much.
I'm a big guy. I'm just
Try and
skinny.
stick by me,
Yep.
yes. Okay, so now we're gonna have our business meeting. So do we have a quorum?
Yes.
Awesome. So can I get a motion to approve the minutes, which were out in the newsletter today and on the website? Motion to approve.
Uh,
All those in favor? Any opposed? Okay, the treasurer's report, we got $6,270.63. Okay, so now we'll go to committee reports. Lorraine, would you like to do the committee report for the Christmas party? I mean, sorry, the Christmas party, whoa, the garden tea party. It's those cups.
I have tickets with me.
Yeah, it is.
Garden Tea Party is Sunday here, right where we're at, right where we're sitting right now. And Tickets are $25. And we would love for you to come. Is it on?
Yeah.
I don't know.
No.
Yeah,
It don't work.
I don't-
Ain't working
It's
tonight.
there.
yeah, it's on.
Okay.
It just doesn't.
Sunday, we are gonna be here from 3 to 6. We have Patty Lyman coming, Patricia Lyman Bass Lyman. I always get her name backwards. She's a wonderful speaker. She's a committee woman for the Republican Party. And if you've ever heard her speak, she's very interesting and very capable, and I'm excited she's coming. So please come and support us. We're gonna have lots of good food, raffles. It's gonna be a good time. It is every year. It's rained the last 2 times we've had it,
Yeah.
and we were
It's gonna be
outside.
inside.
So today, at least, we're inside
Thank you,
Sunday.
Margaret.
So I have tickets with me. They're $25. Please come and join us. Support our need. So that we can come and
This is
do
our
what we're
big
doing right
fundraiser.
here tonight.
Do we need to?
Yeah, we have a wonderful committee together that we have every year that works on this, and we decorate our own tables. Each of us take a table and we decorate it. And if anyone's interested in doing that, even though you're not on the committee, it doesn't matter. We would love